The FDA has taken more testimony today about silicone breast implants and their health risks. Since 1992, major restrictions surround that type of implant, but now some people want those restrictions lifted. Joining me now is local plastic surgeon Dr. Jeff Roth, and we certainly appreciate you coming in. This is a highly controversial issue, and doctor, let's just get right to it. Do you give women the silicone breast implants, and if so, why?
Yeah, it's an emotionally charged issue. You hit the nail completely on the head, and it has always has been. Do I do silicone implants? Yes, but according to the FDA, I can only put them in certain individuals for certain criteria. You have to fill out forms. Typically, in my practice, we use them for reconstructive surgery. What they're talking about today is these folks are going in front of the FDA panel to see if they can have unrestricted use for primary breast augmentations, folks that want to be more shapely, be a little more in proportion.
Okay, so what are the benefits of silicone versus saline? Because I've heard some women say with saline breast implants, they get hard, sometimes you have to pop them loose. I don't know how true that is. And with the silicone, they're just like the natural breast.
Right, what you're talking about is capsular contracture. To answer the first part of your question, there's pluses and minuses, of course, with anything you put in the body, whether it's a total knee, a total joint, a heart valve. Silicone versus saline, that controversy is going to rage on, and we talk about that in our plastic surgery meetings all the time. Silicones typically will feel a little bit better. Traditionally, they've been put on top of the muscle. In my hands, I usually use the saline implants, usually put them underneath the muscle to try to get a little more soft tissue thickness, try to mask the upper pole that you may see some folks walking around with. So it really is dependent upon the individual and what you want to achieve for that individual.
Now, can they really be safer than 12 years ago? Because, I mean, we're talking about some sort of gel, and to me it just oozes out. That's plastic, and your body does a lot of different things, especially women. We go through a lot of changes as we get older. This is gel we're putting in our bodies. Can it really be safer?
Sure. Well, to answer your question, are cars safer now than they were 12 years ago or 20 years ago? And the answer is, as time marches on and as industry catches up and the R&D folks catches up with us, the answer is yes. The ones that are coming out today, the ones that are up for FDA approval today tend to be more cohesive, more like a gummy bear. You can actually take the implant, cut a pie wedge in it, shake it, and you won't have leakage coming out of it. Silicone in of itself has really never gone away, and we use silicone in the body all the time. Everything that is put in the body, whether it is catheters, whether it is IVs, whether it is total knees, all has a silicone outer shell. Diabetics typically will take 20 or 40 grams of silicone into their body per year because of all those injections they have to give.
Wow, that's a good point. Thanks a lot for that, Dr. Jeff Roth. We certainly appreciate it. The debate wages on, and we're going to wait to see what happens today.